So I guess this would be building on that idea of relationship and ultimately what draws us to one another and what in the spirit of that kind of what constitutes a healthy relationship, what are we attracted to and how does that inform us?
We're attracted to people at different levels. There's simple levels of facial attractiveness, for instance. And there have been lots of interesting studies showing infants specifically pictures of adults and finding looking at which pictures the child stares at longer. And the belief is that they will stare at a more attractive face. If you then ask a group of adults showing them the same, say, 100 photos, the adults will do the same behavior. So there is something about facial attractiveness. For instance, symmetry has been shown. If your face is more symmetric, you're more attractive to other people. Averageness, which is an interesting expression, is more attractive. So people of mixed races tend to be more attractive than people of single background to a large group of people. That's one very simple level of attraction. Another level of attraction is more at the psycho-emotional level. Is this person acting in a way that I like? A very simple level. Are they mirroring me in a good way? So if I like honesty and I meet someone who's honest, I'm going to be attracted to them at that psychosocial level. And the last level that I'm most intrigued by is at an energetic level. My belief structure is that we emit, and multiple people have shown this, multiple levels of waveforms. Okay? I'm going to use a very simple analogy. If I have a simple ball of matter here and a simple ball of matter here, and they are emitting multiple waveforms, where those waveforms are alike, they amplify. Where they're dissimilar, they cross each other out. And what you do is you create a co-resonance between two physical bodies. Does this happen with people? If myself and another person have much more similar resonance than dissimilar resonance, are we somehow attracted to them more? And that raises a very interesting question and series of possibilities. As we change our electromagnetic output, our physiologic structure, if you will, by practices, consciousness-based practices, do we make ourselves more attractive? It's an interesting question. I'm not aware that it's been studied in such language, but I'm very intrigued by the idea.
Well, and it also suggests that there may be implications for the healing relationship. That if in fact I think about some of the studies on distant prayer, for example, that failed to show an effect, and there was no attempt whatsoever to combine the resonance frequency, as you're calling it, but I would say, the belief system or the worldview of the healer and the healee in these studies where they're using long distance and the idea that, there is this non-local exchange of information that happens. So it seems as though if we can establish that those dynamics of attractiveness at this kind of biophysical level are true in our direct intimacy, then they must also be true when you start thinking about the possibilities of this kind of interconnectedness at a distance. And that probably the next step in terms of designing research would really begin to operationalize, what those kind of resonances are between us such that we can begin to match ourselves to a healer or a health professional that is more likely to promote a healing response. Would you agree with that?
Well, I agree with it. I think it's possible, but there's a lot of variables. What I would prefer to do as a study would be to train people to shift their own resonance and then use them as the interveners in other people's health. So if we could actually train people in consciousness, in loving kindness, create or recreate their physiology, for lack of a better way of describing it, do they become a better healer? Is the question that I'd like to see answered. It's getting at the same information, but I think we could do it that way as well.
One of the projects we did here was looking at taking couples, one of whom had cancer, and taking the partner of the cancer patient through a loving kindness, compassion, intention training program. And after many weeks of them practicing this, we brought them into our laboratory and we actually looked at the correlation between that sense of loving, compassionate intention and the physiological responsiveness of their partner, and found to a highly statistically significant degree that there was a correlation there. We found this in other studies where there isn't that degree of intimacy, but this was actually one of the stronger results we've ever seen, which then supports what you're saying about beginning to train the healer as the technology, in a certain sense, to begin to enhance this kind of healing relationship.
And for me, the pieces that I'd like to study is train a group of massage therapists and measure the physiology of the person receiving the massage. Acupuncturists, emergency room physicians. Okay? If you do that sort of training, I can pretty much guarantee you that the outcomes are going to be better. And these have very practical application in the real world. So I would love to see that sort of intervention be done.
So thank you, Lee, so much for the stimulating conversation, and it fits so beautifully with the work of the Institute of Noetic Sciences, looking at consciousness as healing and healing as transformation, transformation as healing. They're embedded in the same discourse in the sense that what we're trying to do is move toward a healthier state, whether it's within ourselves and our own mind-body, or within our communities, within our relationship to the environment. All of these represent pieces of what we're trying to do as we think about consciousness and healing in the context of transformation. It's also true that as we think about what's changing today, and so much of what you talked about in terms of the kind of move toward more and more people gaining responsibility for their own health and well-being, this isn't only a matter for people who are health professionals. It's really a matter for anyone who is embodied and has an interest in the idea that we can be more, that we can feel more deeply, that we can respond to one another with greater degrees of loving kindness and compassion and wellness and wholeness. So it's a great opportunity to begin to expand our program, and I'm delighted to have you as part of our team. Thank you.
Thanks.